Endoscopic procedures have revolutionized modern medicine by offering minimally invasive techniques to diagnose and treat various conditions. These procedures involve using an endoscope, a flexible tube with a camera and light attached, to visualize internal organs and tissues. Let's delve into the indications, types, process, risks, and potential complications associated with endoscopic procedures. Indications for endoscopic procedures. Endoscopy is a versatile tool used in many medical fields, and there are several indications for its use. 1. Diagnostic purposes. One of the primary reasons for an endoscopic procedure is to diagnose conditions. Doctors may recommend it if a patient has symptoms like persistent abdominal pain, unexplained weight loss, gastrointestinal bleeding, or difficulty swallowing. For instance, upper endoscopy helps identify conditions like peptic ulcers, gastroesophageal reflux disease, GERD, and tumors in the digestive tract. 2. Monitoring existing conditions. Patients with chronic conditions, such as Crohn's disease or ulcerative colitis, may undergo periodic endoscopic procedures to monitor disease progression or response to treatment. 3. Biopsy and tissue sampling. Endoscopy allows doctors to take tissue samples from suspicious areas for further examination, often to check for infections, cancers, or inflammatory diseases. 4. Therapeutic purposes. In addition to diagnosis, endoscopy can be used to treat conditions. For example, it can be employed to remove polyps, stop gastrointestinal bleeding, or widen narrowed areas in the esophagus. 5. Foreign object removal. It is also used to remove foreign objects that have been accidentally swallowed or lodged in the digestive tract. Types of endoscopic procedures. There are various types of endoscopic procedures, each targeting specific organs or areas of the body. Some common types include: 1. Upper endoscopy, esophagogastrodiadenoscopy. This procedure examines the esophagus, stomach, and duodenum, the upper part of the small intestine. It is used to diagnose conditions like GERD, ulcers, and tumors. 2. Colonoscopy. Colonoscopy is used to examine the colon and rectum. It helps detect polyps, colorectal cancer, and inflammatory bowel disease. 3. Sigmoidoscopy. This procedure is similar to a colonoscopy but focuses only on the sigmoid colon and rectum. It is often used for colorectal cancer screening. 4. Bronchoscopy. Bronchoscopy allows doctors to examine the airways and lungs. It is commonly used to investigate lung infections, blockages, or tumors. 5. Cystoscopy. Cystoscopy is used to visualize the bladder and urethra. It helps diagnose conditions like bladder cancer, urinary tract infections, and kidney stones. 6. Capsule endoscopy. In this advanced procedure, a small capsule with a camera is swallowed by the patient. As it travels through the digestive tract, it captures images that help diagnose conditions in areas that are difficult to reach with traditional endoscopy. 7. Endoscopic retrograde cholangiopancreatography, ERCP. ERCP combines endoscopy and X-rays to examine the bile and pancreatic ducts. It helps diagnose and treat conditions like gallstones, blockages, and tumors. 8. Endoscopic ultrasound, EUS. EUS combines endoscopy with ultrasound imaging to examine the walls of the digestive tract and nearby organs. It is particularly useful for detecting cancers in the digestive system. How endoscopic procedures are done. Endoscopic procedures are typically performed in an outpatient setting, though some may require hospitalization. Here's an overview of the general steps involved. 1. Preparation. Before the procedure, the patient may be asked to fast for several hours to ensure a clear view of the organs. For procedures like colonoscopy, a bowel cleanse may be required to clear the digestive tract. 2. Sedation. Most endoscopic procedures involve sedation or anesthesia to ensure patient comfort. Depending on the type of procedure, the level of sedation may vary from mild relaxation to deep sedation. 3. Insertion of the endoscope. The endoscope is gently inserted into the body through a natural opening, such as the mouth, for upper endoscopy, or the rectum, for colonoscopy. For procedures like laparoscopy, small incisions are made to insert the endoscope. 4. Visualization and intervention. The camera at the tip of the endoscope transmits images to a monitor, allowing the doctor to visualize the internal organs. If necessary, tools can be passed through the endoscope to take biopsies or perform interventions like polyp removal. 5. Completion. Once the procedure is completed, the endoscope is slowly withdrawn. The patient is monitored as the sedation wears off, and most can return home the same day. Risks and complications of endoscopic procedures. While endoscopic procedures are generally safe, like all medical interventions, they carry some risks and potential complications. It's essential for patients to be aware of these before undergoing the procedure. 1. Infection. Although rare, infections can occur at the site where the endoscope was inserted or in the organ that was examined. To minimize this risk, strict sterilization protocols are followed. 2. Bleeding. Minor bleeding can happen, especially if a biopsy was taken or a polyp was removed. This is usually self-limiting, but in rare cases, additional treatment may be required. 3. Perforation. In very rare cases, the endoscope can cause a tear or perforation in the organ being examined, such as the esophagus, stomach, or colon. This is a serious complication that may require surgical repair. 4. Adverse reaction to sedation. Some patients may have an allergic reaction or other adverse effects to the sedation or anesthesia used during the procedure. Close monitoring during and after the procedure helps manage these risks. 5. Pancreatitis. For ERCP carries a higher risk of pancreatitis, which is inflammation of the pancreas. This complication can cause severe abdominal pain and may require hospitalization. 6. Discomfort and soreness. After the procedure, patients may experience mild soreness, bloating, or discomfort, particularly if air was introduced into the digestive tract during the examination. These symptoms usually resolve within a day or two. 7. Complications from underlying conditions. Patients with existing medical conditions, such as heart or lung disease, may be at higher risk for complications during the procedure. It is crucial to inform the healthcare team of any pre-existing conditions before the procedure. Conclusion. Endoscopic procedures are invaluable tools for diagnosing and treating a wide range of medical conditions. With advancements in technology, these procedures have become safer, more accurate, and less invasive. While there are risks involved, the benefits often outweigh the potential complications. Proper preparation, skilled healthcare professionals, and post-procedure care contribute to the overall safety and effectiveness of endoscopic procedures.